Chiropractic care is a drugless alternative method of healthcare that does not replace traditional veterinary medicine. Chiropractic care deals with the nervous system that is housed inside the spinal column. The spinal cord carries all the nerves that go to every organ in the body. These nerves exit the spinal column through vertebrae, which are the individual spinal bones. Chiropractic maintains an adequate nerve supply is vital to the proper functioning of the entire body. Modern medicine has determined that the weight of a feather placed on a nerve will decrease its transmission by 50%. When the vertebral bones are misaligned, even very slightly, they affect the nerves and the flow of nervous energy. Chiropractors call these small misalignments subluxations. The chiropractic adjustment is aimed at correcting the subluxation and restoring the proper function of the nervous system. Chiropractic thus works to eliminate the cause of the problem and not just simply treat the symptoms. Equine locomotion can be compared to a symphony orchestra playing a composition. All parts must blend into harmonious pattern, from the gentle sway of the head and tail for balance to the coordinated efforts of each limb and body muscle to accomplish its special function. Conversely, also like an orchestra, if all movements are not attuned to the whole, a major fault should be evident. Roy, 1971. When the horse moves, the hind limbs are the motors of the locomotion and drive the trunk forward. Where the head goes, the body will follow. Energy is generated when your horse collects its hindquarters. When motion is generated at the rear of the animal, it travels fluently to the front like a wave. When the motion is interfered with, so is the motion at the front of the animal. The horse is a prey animal and must have 360 degrees of vision in order to survive. Use a food treat to get your horse to voluntarily turn its head and show the range of motion. The treat should be held at or near the shoulder. Twisting usually signifies a problem at the pole. Partial bending followed by backing usually points to a problem lower in the neck or upper thoracics. Your horse may benefit from chiropractic care if he or she exhibits one or more of the following problems: decrease in level of performance, problems or difficulty executing desired movements, short striding, gait problems such as cross canter, loss of collection, refusal to pick up a lead, behavioral changes, refusals, cinching, bucking, injuries resulting from falls, training, or other activities, muscle imbalance, spasms, or atrophy, diagnosed conditions such as degenerative arthritis, stressful situations such as poor conformation of the horse, various riding and training equipment, performance level and ability of the horse, shoeing. The horse spinal column has over 100 separate joints. Each of these joints must function correctly for it to perform appropriately. The amount and direction of spinal movement is determined mostly by joint size and shape. The neck and tail are the most mobile regions of the horse's spine. Limited back movement occurs in up and down motion, side-to-side motion, and rotation. When a horse loses its normal range of motion in one or more of these joints, there must be compensation elsewhere. Compensation may result in an altered gait. To return the joints of the spine to normal motion, an AVCA-certified chiropractor will perform an adjustment on the area of the spine affected. A complete chiropractic examination includes taking a case history. What is wrong with your horse? How long has it been going on? Posture analysis. Does the horse have any major problems when standing still? Gait analysis. Static and motion palpitation of the spine. Chiropractic adjustments are specific, low-force, high-velocity adjustments aimed to correct joint misalignments and to restore proper skeletal movement and muscle and nerve function. The movement within these joints is minute, and therefore the adjustments by the chiropractor will be small but significant. Equine chiropractic adjustments are aimed to adjust one joint at a time and not the entire animal. Chiropractic care takes time, since we are allowing the body to heal itself after the proper nerve functioning has been restored. Animals recover very rapidly as a rule, but older animals and more serious problems take more time. Some problems may be so serious that chiropractic will not completely solve the problem. Sometimes referrals for laboratory analysis or radiographs may be necessary. This is the case when problems such as fractures may be present. The speed of the recovery depends on several factors. The length of the time the problem has been present. The more time that has elapsed since the onset means the recovery may take longer. It takes time to get sick, and it takes time to get well. Age and physical condition of the animal. Older animals are slower to heal. It is not possible to return a 24-year-old mare to a youngster, but the quality of her life may greatly increase with chiropractic care. Damage. Sometimes there is simply no repair for seriously damaged tissues. For example, if the spinal cord is damaged by a ruptured disc, there may be slow and minimal healing with any treatment. Cooperation. The speed of the recovery often depends on how well the owner will cooperate with the animal chiropractor who is treating his animal. If the animal is removed from care too soon, the best possible results may not be achieved. Contact an AVCA certified chiropractor today to get your horse started on the road to better spinal health.